physical therapist on the internet.
Posture, Brad. Posture.
What do you mean I got posture?
Hi, folks. I'm Bob Schrupp, physical therapist.
How's my posture? Oh, Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
Today
Bob.
we're going to show you how to strengthen an arthritic or painful knee. You're a little bit bound down by the fact that it hurts. So sometimes when you strengthen it, that makes it hurt more.
Right.
And we don't want that.
Yeah, when it's painful, you just automatically guard it.
Right.
So there's ways around it, and we'll show you some.
Yeah, let's start with the first one, the most easiest.
Yep.
And this is a very common muscle to get weak when you have knee pain. That's the quadricep muscles, I should say.
If you ever feel like you're walking and your leg wants to buckle, that's because the quad's weak.
And this one's a very easy one to do. You just get a pillow. You can do it on a bed if you want.
Sure.
And you place the pillow under the knee.
Yep.
And you're just going to press down with the knee. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, which is what 6 seconds? 5 seconds?
10. One of the if you want to go through them fast. But no, you want to go about 6 to 8 seconds. And this is nice, like on your bed or a couch, where you can kind of lean back and do that. That's very convenient.
Yep. Really easy. Anybody can start this one. It's not going to hurt you because there's not very much knee movement, but it makes a big difference. And you can do 3 sets of 10 3 times a week if you want.
Right, to start. And I think, the pillow, the size of the pillow, you could try a towel roll, move things around a little bit so you get in a comfortable position.
Yeah, you can experiment with it.
Exactly.
All right, next one, number 2 is shallow squats, especially for the beginner.
Yes.
If you do shallow squats, which mean you don't go very deep, you're actually not getting much of the knee joint, and there's not much grinding going on.
Right. So I always think of it and tell my patients, you got some arthritic problems in there, and we don't want to get too deep. And as you work it more, we're kind of smoothing off that arthritis, grinding a little bit.
You could do ball on the wall, Brad. Sure.
Or even if you have a smooth
slides,
wall.
Yep.
I've had people do this. A lot of times a door that is smoother than a wall that allows that. If you have a ball about this size or the bigger ball, that really
these work really nice.
Yeah.
This is a great way to do squats.
Yep. So feet wide, make sure your feet don't slip. If you got a smooth floor, you got to have something with grippy shoes. And then, and
we don't want to be responsible for anybody going down.
Right. And you just go down as far as you want. You're not going to go way down to here right away, and you may never get that low.
Eventually, you may.
Yep.
It is what we have kind of had a change of thoughts,
right?
Haven't we? Knees over toes now. We believe in that we should train it.
Well, I'm still working. I'm a slow believer. I'm thinking, it's okay, but if you've got arthritis and you're older,
if it hurts, you're not going to do it.
Yeah, take your time. You may have something like this, so you got something solid, and then it's okay. And then
the ball actually works for doing well for deep squats.
It does. Yep. And if you do want to go knees over toes, and I've got something to hold, if I do like this, it's not painful, but if I go like this, then use your assistance.
The other option is you can actually do squats on a slant board, Brad.
Yeah. A lot of people may not have a slant board.
Right. And they don't have a ball either sometimes, but
but like I said, you don't have to have one of these big balls for this one because you're not putting your body weight on it.
So if you get on a slant board, it's a lot easier to squat down further because your heels don't come up, obviously.
Yeah, they're already up.
Yeah.
It needs to be a grippy slant board. This one's got a really nice grip. And I think even like something like this, a sturdy chair to help you balance would be a good way to start.
What I do, Brad, I actually have one of those boards at home.
Yeah.
And I put it in front of my bed. And I just go like this.
Oh, and you use a bed for a cushion?
Yeah, exactly, if I need to. And a lot of times I don't.
And then if you get tired, you can lay down and take a nap.
Yeah, just fall into it and wake up a few hours later and ready to go. All right, split squats. We just did a video on these, Brad. For the beginner, you can actually put a pillow down if you like. You can start off, get in a position like this, and you can actually use the bed or the couch.
Yeah, I'll give you a little help there,
going like this. Yeah, I'll tell you, it's been amazing.
You don't need that, huh?
No, it's been amazing to me, Brad, that I started these, and I did need that at first.
Sure.
I mean, very weak, and how much they have come along now.
Sure. How many? What's your repetitions?
I do 10, and then I do another 10 with the knees bent like this.
Yep, to get that
and
flexion.
to see how that, how I tolerate that, and I go like that. I do a little crack in there, but no pain.
Right. Yeah. You know,
And
if
I
your
do
knee
both
cracks
sides.
and it doesn't hurt,
No,
it's probably
fine
okay.
then, right?
Yeah.
It's probably okay. We're not sure.
Well, you never know. If it, one time it cracks and it hurts.
Now you can do hamstrings, and you can do it actually. Just bridging itself is a way to do hamstrings. You're getting some. It's good for the beginner.
Yes.
And if you go further out, it's harder on hamstrings.
Yeah. If you think about digging your heels in down to, that'll give the hamstrings a little more work.
Now, if you have the ball,
you're probably not going to do this on a bed, but
no, you do it on the floor. But you could start with just digging your heels in and pulling it back and forth again for the beginner.
Yeah. Think about squishing the ball. You can see Bob is digging his heels into it.
And you could also do single ones. You know, just pressing the heel in. But then you could also do double with the butt lifted up.
Yeah.
Oh, look at me go.
Yeah. So, you know, it's amazing, but you're working hamstrings plus some core, some other hip muscles that are helpful to...
Now, Brad, you'll do these too, won't you? That's too much for me.
Yeah. Oh, especially, you know, if you're on the floor, it would be a little more stable.
Right. So, next one is, again, kind of a call out to the knees over toes guy.
Sure.
He actually does, he strengthens the anterior tibialis, which is a muscle in your lower leg here. It helps when you're going
up the stairs.
Yeah.
One way or another, we're going to strengthen. If you don't have any, because it is kind of a hard one to strengthen, but this works good. You can start out by leaning on the wall and simply,
very simply bring your toes
up like that. And that's, you know, if I did 10 of these in a row, and especially if I went to 1 foot, that's quite a bit harder.
Right.
So
you start off with just both of them at the same time, do 10, and then work till 1.
And this works better with shoes on. I don't think
Right.
you could do it with your shoes off, but it's probably better. You get a little more leverage that way.
It's not a typical one you hear of with strengthening for knees.
No, and I still don't.
Yeah, you don't buy it, do you?
Well, I do, but not.
And the last one
I'm a
is
slow buyer.
This one. I think you will agree with. Even is the gastrocnemius does go across the knee,
right,
and
right.
it helps strengthen that. So we can start off with both legs. You know, you can just go like that.
Yeah.
And then eventually you
just
work
what they want to see is a shot of your butt.
Focus down lower, Mike.
Yeah, get it down there.
And eventually you could add weights in, I suppose. Or I used to see guys that would grab on the back. And
they're
crazy, a little wacky.
From the top up there.
Yeah.
But you want to make sure your knee is more straight. If you bend the knee more, the gastroc.
You're getting a soleus.
Yeah, which doesn't cross the knee.
No,
but it'd still probably be good for it. I mean,
So,
if the anterior tib does that.
There we go. You know, you don't have to necessarily do all of them.
Right.
But you may want to try to get a fair amount of them. Do the ones that aren't painful.
For sure.
Yeah.
For sure. Right.
And by the way, this is a part of a series of programs on treating the knee. Series of videos on treating the knee.
Right.
So go to bobandbrad.com, go to the program section, and look for the one on knee pain. Watch the ones that pertain to you.
Yeah, just look at the titles. You can scroll through them. When you see one that says, oh, that's what I need, watch the video. They're usually about 10 minutes long. There is a PDF printout you can click on, and it'll print out a review of the video as well as the exercises. So it's nice to have right in front of you.
Yeah, there's a PDF on this one, on this video that we did today.
There's a PDF on all of them,
I know.
Wow.
Well, I'm just showing you as an example. This is a PDF of this one. So if you want to see the exercises without going back, we'll have them laid out.
But they're not on the screen.
No.
You could turn the camera off. This is another problem.
All right. Thanks for watching.